Finally, a look at the future of science and medicine. Charles Drew University is one of only 4 historically black medical schools in the nation. This SoCal school is committed to researching and addressing health issues which disproportionately affect minority communities. Aziza Schuler has more.
From a young age, it was evident to Lesly Torres Gonzalez that disparities exist in the healthcare system. As a child, she says her English was much better than her mom's, who'd immigrated to California from Mexico. She often depended on Lesly to translate for her at doctor's appointments and help fill out medical documents.
Seeing her experience like not understanding or, having certain issues that she couldn't find a way to address just sort of made me realize that these health disparities exist, and sometimes it's hard to address, one, because there might not be enough diversity in the medical field.
She was inspired to change that. As a graduate research student at Charles Drew University of Medicine, Lesly studies diseases that disproportionately affect black and brown communities. For example, currently she's examining breast cancer tumors to find out how genetic mutations differ by ethnic background.
Some cancers have a higher prevalence in some populations or higher mortality in other populations, even though the treatment is fairly similar at this stage. So understanding the genetics might help us develop a more individualized approach.
Research programs like this one at CDU will benefit from a new bill recently signed into law. California Representative Nanette Barragan authored the John Lewis Research Endowment Revitalization Act. It expands funding under the Public Health Service Act to include critical research into health disparities through programs at historically black universities and colleges. More funding means they'll have the budget to hire staff and provide scholarships for students who come from underserved communities. Lesly says if the people in the lab actually represented the communities they're attempting to study, she believes people of color might be a little less hesitant to participate in clinical trials. According to the Journal of American Medicine Association, minority groups are vastly underrepresented in clinical studies.
I feel like that sometimes is due to miscommunication, sometimes because of language barrier. The sort of vocabulary that's used is sometimes a little hard to understand for some people.
But she's optimistic that once we see more minorities conducting and participating at the research level, it'll build trust in the process.
Our thanks to Aziza.